Amniotic fluid. It's more than just water surrounding a baby. It's a lifeline, a cushion, and a key indicator of fetal health. But what happens when there's too little or too much? In this video, we'll explore how ultrasound reveals two important conditions: oligohydramnios and polyhydramnios. Whether you're a medical student trying to master prenatal imaging or a parent wanting to understand what these terms mean for your baby, this one's for you. Amniotic fluid is the unsung hero of your prenatal world. This clear, slightly yellow liquid cushions the baby like a protective pillow, absorbing bumps and shocks, supports development by allowing free movement, building muscles and bones. It aids in lung and gut growth as the fetus breathes and swallows it to practice before birth. It regulates temperature and guards against infections with built-in antibodies. And it keeps the umbilical cord safe, preventing compression and ensuring steady oxygen and nutrient flow. Sometimes there's too little amniotic fluid, and that's called oligohydramnios. Or sometimes there could be too much, and that's called polyhydramnios. Both can signal important health issues, so let's break it down. Oligohydramnios means there's too little amniotic fluid. Think of a deflated balloon. It can cramp the baby's movements and even affect lung development. Now let's discuss the most common causes of oligohydramnios. There is premature rupture of membranes, the most common cause overall, fetal renal abnormalities, especially bilateral renal agenesis or urinary tract obstruction, placental insufficiency, seen in conditions like intrauterine growth restriction and preeclampsia, post-term pregnancy due to declining placental function, and certain medications, especially ACE inhibitors and NSAIDs like endometrium. On ultrasound, we measure the amniotic fluid with the help of the single deepest pocket or the amniotic fluid index. The single deepest pocket is measured by taking the vertical diameter of the maximum free lagoon. The normal value is between 2 to 8 centimeters. To calculate the amniotic fluid index, we divide the uterus into 4 quadrants and measure the vertical depth of the largest fluid pocket in each quadrant without any umbilical cord or fetal part. Then we add them up. The normal value of AFI should be between 5 to 24 centimeters. So an AFI of less than 5 centimeters is oligohydramnios. An STP of less than 2 centimeters is also diagnostic. Oligohydramnios is linked to complications like growth restriction, cord compression, and even stillbirth. That's why early detection is key. Now let's talk about the opposite, polyhydramnios, or too much fluid. The baby is swimming in a giant pool instead of a snug tub. Common causes of polyhydramnios are idiopathic, most common unknown reason, maternal diabetes, fetal swallowing problems, for example anomalies like anencephaly, GI atresia, twin-to-twin transfusion syndrome, fetal anemia or infection, genetic syndromes, for example Down syndrome. On ultrasound, AFI greater than 24 centimeters or STP greater than 8 centimeters is diagnostic for polyhydramnios. Notice this large black area? That's all fluid. Too much of it can stretch the uterus and lead to preterm labor or cord prolapse. Understanding amniotic fluid isn't just about numbers, it's about your baby's well-being. Whether you're scanning as a student or preparing as a parent, this knowledge empowers you to ask the right questions and make informed choices.